I'm joined now by Jeff Flaks. He's the CEO of Hartford HealthCare, and they say necessity is the mother of all invention. And I guess that's one bright spot is all the rapid innovation that you've seen. Thank you for being with us, Jeff. Innovation is something you're seeing a lot of quite quickly, right?
The innovation that's occurring here in Connecticut is absolutely remarkable. The number of companies who've come to our aid, who are figuring out new ways to do things, who are manufacturing face masks, face shields, the way we're using 3D printing, the types of ways we're adapting and adjusting our practices is absolutely incredible.
And even the way that you're speaking to the community, I just want to take a moment here and share with our viewers this new commercial that's running on TV that is not something people would have imagined hearing from a healthcare provider. Let's take a look.
Today, we will be put to the test. We will be challenged, and we will rise. We stand for hope. Hope for tomorrow. Hope for recovery. We stand for caring and compassion, for innovation. Wherever you stand, we stand with you. I'm Jeff Flaks. We are Hartford HealthCare. We stand together.
It really, I have chills as I watch it. I mean, it just really shows what a critical time we're in and how much it requires everyone's effort.
Kara, it absolutely does. You know, we believe in hope. There are great examples of things to be encouraged about while we work through this crisis. And I do believe we within our state and certainly within our healthcare systems, we're going to come out on the other side of this and we're going to be stronger for it. And the more attention we can bring to the incredible work that's occurring on the front lines and the incredible advancements and innovations that are occurring, I think the more promise we have while all of us in the state are having to work through making difficult decisions every day and sacrifices as we address the crisis.
Information is key. Tell us about this new partnership with MIT that might help us predict a little better.
Sir, we were really pleased today to announce and roll out the partnership with MIT. Professor Demetrios Bertosis is really the world-renowned expert around analytics and machine learning, and he is the dean at MIT. We benefit from having a long-standing relationship with MIT, and they are our partner in the Hartford HealthCare Innovation Center. So several weeks ago, he turned all of MIT's expertise and put 20 full-time PhD students and faculty members around developing a worldwide model. And because of the relationship with Hartford HealthCare and our commitment to transparency and accessibility, he used our data to be his proof point. And today he's announcing it and opened a website that is available to experts around the world. So we're privileged to be part of it, but most importantly, we benefit from it enormously here in Connecticut.
Also, I want to just talk about this new symptom tracker. A lot of people are concerned. Could they have COVID? How do they know? You actually have a new digital symptom tracker?
These are examples of the innovations that are happening, the way we're making care more accessible, the way we're working differently. But again, I urge people to go to our website, hartfordhealthcare.org. All of this information is there. And most importantly, we do still remain with a 24-hour-a-day, 7-day-a-week call center where at any point in time, a person in the community or a caregiver within the community, quite frankly, can call our center and speak to clinicians, physicians and nurses. And just as an example, Kara, we've now done over 20,000 telehealth visits. So we're using all types of new ways to connect to people and when they need it most during this time.
What about the PPE? We heard from the governor this morning that the state has made a purchase of a large amount of it. Does that mean we are not in a crisis, or what's the status?
I would hesitate. I think it's important to manage those expectations because PPE is critical, and every day our practices are changing, and as we care for more patients or open up new centers, like the center that's opening up this weekend, that we're building at the convention center, which will have 640 beds. So as we create new capacity across the state or care for more people, it puts more demands on our PPE. That being said, both our organization and the state have spent tens of millions of dollars to bring in as much PPE as we possibly can during this time period, and we are better situated today than we were just several weeks ago. But we have to continue to be vigilant in terms of acquiring more as we go forward, not knowing the duration of what we're up against.
What's your latest assumption about when the peak will be here?
So the model that MIT rolled out today calls for the peak for Hartford HealthCare facilities to be approximately April 30th. But that model gets revised every day. and based on new information, there's many levels of elements to get incorporated in how that model was developed. So it has a high level of sensitivity. So it is subject to change, but it is revised frequently, and we are planning for today, with the peak being in that April 30th, May 1st timeframe for our facilities.
Jeff Flaks, CEO of Hartford HealthCare, we want to thank you so much for being with us and sharing that information.
Thank you, Kara.